Hey everyone, it's Lenore with the Medicare Authority, and I wanted to show you how to fill out what we call a scope of appointment form. Medicare requires us to get your formal permission to review Part D drug plans and Medicare Advantage plans. And this is just a simple compliance form that is interactive, and I'm here at my email, and you can see that this is what you will get from us when we request a scope of appointment. You're going to see my name here, and then you're going to see Medicare Health Plan scope of appointment. And I've created a profile for Miss Betty Boop. So here's what is going to be sent to you from us to fill out your scope of appointment. It says, Dear Betty Boop, please click on the link below to be taken to your secure website where you can electronically sign the scope of appointment form required before we discuss your Medicare health options. And there's a blue line that says scope of appointment document. And then my information is right here, but you simply have to click on scope of appointment document. Okay, so this will take you to what we call our client portal, where you should be able to put in your date of birth. And I've just made a fake one here for Ms. Betty Boop. And you should be able to put in your zip code. Sorry. Now, because it's secure, it's going to ask for your birthday and your zip code to get in here. You're going to click on Continue. And then it takes you to Scope of Sales Appointment Confirmation Form. This form is required prior to one-on-one marketing appointment to ensure understanding of what will be discussed between the agent, which is me, Lenore, and the Medicare beneficiary, which is you. All information provided on the form is confidential and should be completed by each person who has Medicare or their authorized representative. Now, this form is going to come to you already pre-checked to review standalone drug plans, Medicare Advantage plans, and other health-related forms. So there's nothing you need to check here. And then where it says beneficiary authorized signature, this nice yellow line, you're going to sign your name. Okay? It doesn't matter if you put your middle initial or not, just sign first and last name here. You'll notice that there's something called representative name and relationship to beneficiary. This does not need to be completed unless you are signing as a power of attorney or representative for like maybe your parent or a spouse who is not able to do that themselves where you are their power of attorney. But if they are able to do it themselves, you're not representing them. So you should sign your own name here and just ignore this part unless you're doing it for a parent or someone that you are power of attorney for. Where it says submit, you're going to click this green button, submit. Underneath, you're going to see information completed by the agent. It has my name, my phone number, my address, or Betty Boop's address, that is. Our contact was by phone. And then there's some other helpful hints along here, okay? But this is a really simple form. All you're going to do is type your name in the yellow line and click the submit button. All right, so we have Ms. Betty Boop's form submitted to us, and it's as simple as that. The next thing we're going to do is we're going to ask you to fill out a self-service form, and I'm going to send this to folks who may be already on Medicare. So sending out what's called the self-service request, and that is like a patient portal. If you have a doctor that you see, they have a portal where you can enter your information. This is where you're going to be able to enter your prescriptions and your doctors. Okay? We may send these, there are two separate emails. They don't come together, but you can see again, it comes from me and it comes to Ms. Betty Boop, review your RX and contact information. If you are doing this by a phone, sometimes it doesn't work very efficiently. However, if you do it by regular computer or tablet, it should work just fine. So again, we're going to click on the email. Oops, Sorry about that. There we go. And you can see it says, hello, Betty. Guess what? It's that time of year again to spend a few moments carefully reviewing your personal contact information, your medications, and so forth. And then it asks you to click here to review and update your information. Now, pre-filling this out is going to help streamline our appointment so that we can look at the plans that are available and make a recommendation more quickly. Okay, so here's, again, we're going to enter Betty's date of birth and her zip code. This is going to take us to a self-service portal. We can put, if we want to be Ms., we could be Ms. Betty Boop. We can put in our initial, our middle initial. Okay. Okay. We should be able to fill out our Medicare ID right here. If you have that, you can put your Medicare ID when Part A and B is effective. If you have state Medicaid, you can put that in here. You can see that the address is here. Now, it may not allow you to put the middle initial in. That's okay. We can do it on our end. But if we can get your Medicare ID, that would be great. Your address also. It will allow us to update this. Let's say we wanted to put like apartment A. We can do that. And it will allow you to update your phone number, your email, and if you'd like to put an emergency contact. Felix the cat. We'll make him our emergency contact. And we'll say we're going to use Felix's phone number. And then Felix is our spouse. It's not your spouse. It could be a friend. That way, if Felix calls for Betty, we can check. We know that he's authorized to speak with her or be on the call. Okay. All right. So now Betty can enter her prescriptions, and this is where you will enter your prescriptions. So I'm starting to enter prescriptions. I type in the first couple of letters. It comes up with a couple of suggestions. I'm going to search for my drug, the atorvastatin, 40 milligrams. I take one a day, so that means I take 30 a month. If I'm taking a 3-month supply, that would be 90. Then I'm going to add my medication. If I'm taking my medication, it lets me get the medication. So here we have Epic, and then this is 3 pens. This is also 3 pens in a package. And then I get one a month, so I'm going to add that there. Okay, you can see levothyroxine. It has a capsule or a tablet. You want to try to click on the correct. You see it comes up capsule. We're going to go to tablet, and we're going to fix that because we get a 90-day supply. Every 3 months, we take one a day. Okay, I'm finished entering that. Now my preferred pharmacy, when I put in a zip code, it's going to list some of these pharmacies. So I'm going to check that I go to CVS. I'm going to hit next. Now it lets me put in my provider. Okay, it lets me pick up my provider. That's not my provider. This is my provider right here, or Betty's provider. So you search for your provider by name, then you have to hit select provider. Now if you're putting in a specialist, you have to change the provider type to specialist, and then I have to put in the name of the specialist. Okay, so again, that's not really, let's see if I can get my, no results. So I'm spelling my specialist name wrong. Let's search. And we'll just say this is, I don't know who this is, but I'm going to say it is my specialist. I'm going to hit the save button. And oh, it doesn't look like it's saved. I'm going to click add provider. We're going to click a specialist. We're going to search for Dr. Jones. We're going to click on select, and then we're going to save. Okay. So you can say I added a specialist, so I added my primary, and then I want to add one more specialist. So I'm going to click here, go to specialist. I'm going to search for Dr. Smith. There's a bunch of Dr. Smith. I'm going to say this is my Dr. Smith, and then I'm going to hit save. Okay, a lot of times we're going to want to jump to save, but that's not going to save it. Okay, then I'm going to hit the next button, and here's a summary of all my stuff. Now, if for whatever reason it doesn't work perfect, then you are okay to just complete what you can. Here also, if you're not taking any medications, when we were on medications, you can select no active drugs, okay? All right, so everything looks good. If for whatever reason you're not able to edit, not a problem. Go ahead and confirm and save. At least we have your profile started. All right, brings us back to the portal where you can enter your self-service. Okay, so from my perspective, when I meet with Betty, I am able to see all of Betty's prescriptions and her providers. So that way I can make a quote for a prescription drug plan or a Medicare supplement, a hospital indemnity. We have a lot of opportunities here, but by filling out the self-service, it just helps expedite our appointment. Thanks so much.